Hi, my name's Jana. I'm a student nurse. I would like to get an SPA on your patient.
Hi, so we'll be taking care of Ryder Kine in room 620. His admission weight is 171 pounds. His height is 5'11". He's a 67-year-old African-American male. Date of birth is January 1st, 1950. He has no known allergies. He's full code. Around 4:10, the patient was complaining of burning pain in the right heel. His pain was 6 out of 10, so we went ahead and morphine was administered, and around 4:45, his pain was 1 out of 10. The patient was resting comfortably. Ryder Kine was admitted Tuesday with diagnosis of stage 2 diabetic ulcer on right heel. Secondary diagnosis is diabetes mellitus type 1. He had a complaint of increased blood glucose reading for past 5 days, with readings consistently in the 300s, and non-healing wound of right heel that was noticed 3 weeks ago. His diabetes was diagnosed 20 years ago. He's insulin dependent. Since then, until 3 weeks ago, blood glucose was in the 120 range, with last hemoglobin A1C checked 3 months ago, which was resulted in 5.2%. His father died at age 53 of myocardial infarction, and his mother died of lung cancer at 78. He had a transurethral prostate resection 5 years ago. His fall risk is medium. His pressure ulcer at risk. He has no visible distress. Speech is clear. Posture upright and steady gait. Patient is well groomed and appropriate during exam. His cranial nerves are 2 to 12, grossly intact. His pupils are equal, round, reactive to light. His mouth is moist. He's alert and oriented times 4. He has qualitative deficits in being able to identify sensation with pinprick to bilateral lower extremities. His lung is clear to auscultation in all lobes. Breathing unlabored, no use of accessory muscles. He's O2 sat on 95% on room air. His respiratory rate is 16. S1, S2, no murmur, rub, or gallop. Regular rate and rhythm, no carotid bruit. His abdomen is flat, symmetrical, and soft. No tenderness. Vowel sounds present in all 4 quads. His no ascites, no bruit present. His diet is 1800 cal diet, 2 gram sodium restriction. Around Tuesday, around 3:50, he had an output of 320 milliliters urine void. His urine specimen is clear and yellow. His skin is dry and intact except for stage 2 ulcer on right heel. Wound is 5.5 centimeters by 2.5 centimeters at largest diameter and 3 centimeters deep extending into the dermis. No tunnel or undermining noted. He has moderate serosinuous exudate. 5 out of 5 muscle strength in all extremities. No clubbing, cyanosis, or edema to extremities. Patient pulse is palpable bilateral radial, dorsalis pedis, and posterior tibial. He has an IV in the right median vein, forearm peripheral. IV site without signs or symptoms of phlebitis or infiltration. His albumin is 4.2, bilirubin is 0.7, protein total is 7.1. His sodium is 141. His potassium is 3.8. His chloride is 104. His BUN is 19. His ALKP is 97. His ALT is 38. He has a blood sugar fasting of 310. His HbA1c is 6.5%, which is good diabetic control. His glucose is 290, which is high.
Okay.
Do you have any other questions?
Yes, I do. Why specifically this client receiving medication?
Ryder Kine has been diagnosed with diabetes for 20 years, so he's insulin dependent. His glucose is in the 290s, so we're going to be administering.
What does the medication have? Does the medication have an action?
Insulin stimulates glucose uptake in the skeletal and muscle and fat, so it inhibits hepatic glucose production.
When you should question by administering this medication?
When his glucose levels are below 60s, or if it's above 301, then we should notify his provider.
Okay. Does the medication have a serum therapeutic level?
When his blood glucose is within the normal range, which is 60 to 100, and when his HbA1c is less than 7%.
Okay. What vital sign must be monitored?
Vital signs that must be monitored is his blood glucose and his blood pressure, because around 350 and 410, his blood pressure was 145 over 72, and then the one at 410 was 140 over 72.
Which physical parameter should be monitored when medication is being administered?
For physiological, we would check if he is nauseated or vomiting. So that means the medication, he's having side effects of the medication.
What intervention must be taught to the client at hospital to ensure given medication safely?
To notify us if he is having any side effects of the medication. So if he's having any dizziness, foody mouth smelling, if he's having nausea, confusion, dizziness.
Any intervention when teaching clients at a home?
We're going to teach the patient how to properly store the medication, when to use the medication, how to use the medication.
What's some side effect and potential adverse reaction?
Side effects is when he has high blood sugar, he's going to have dizziness, fruity mouth smelling, nausea. And then when he has low blood sugar, he's going to feel anxious, confusion, and dizziness. And then when he has adverse reaction, it's allergic reaction, so he'll have skin rash, itchy or hives, swelling of the face, lips, difficulty breathing, anaphylaxis.
How would you know this medication is effective?
When we check his blood glucose within about an hour, so then if his blood glucose is within 60 to 100, then we know that the medication is working.
Okay, that's all I have question for now.
Okay, would you like to come see me administer the medication?
Yes.
Okay. Mr. Ryder?
Yes.
Hi, my name is Vivian. I'm a nurse today. We're going to be administering your regular insulin because your glucose is high. It's at 290.
Okay.
Okay. So I'm going to pull up the patient's chart. Can I have your name, date of birth?
Ryder K. January 1st, 1950.
Okay, so Ryder Kine. I'll see that his name is matched up with the chart and his birthday's matched up with the chart. So do you have any allergies?
No.
Okay, so I'm going to check in in his chart to see if he has any allergies, and he just verified that he doesn't have allergies. And Ryder does not have any allergies, so I'm going to pull out the medication. I'm going to compare the medication against the MAR. So it's regular insulin, and then I have regular insulin right here. I'm going to check the expiration date, which is 2020, and then I'm going to check if it's clear and colorless, which it is. And then I'm going to so I'm going to check in the order to make sure it is the right dose, since his blood glucose is 290. We're going to be administering 16 units in the subcutaneous area. And then I'm going to check that it's insulin regular with insulin regular. going to check the time. We're going to be administering the medication at 5:10. When was your last meal? Did you eat anything yet, Mr. Ryder?
No, I haven't.
Okay, so we're going to administer your medication, and then you should be having your meal shortly, and you should eat after we administer the medication.
Okay.
Okay, so can you verify your name and date of birth again? I'm going to check your wristband.
Ryder Khan, January 1st, 1950.
Okay, so the wristband matches with what the patient said. And then I'm going to check on the chart to make sure that it's the right person again, right birth date. And when was your birthday? January 1st, 1950?
Yes.
Okay. Okay, and where did you have your last shot of insulin at?
In my left abdomen.
Okay. So I'm going to scan the patient's barcode or type it in. And then I'm going to check the medication again, regular insulin against the MAR. And then it says insulin regular. And I'm going to type in the medication. Okay, so the MAR verified that it is the right person and the right medication. Okay, so I'm going to put on my gloves. I'm going to clean the top vial. And then the MAR, the order said to inject or administer 16 units of insulin. So I'm going to withdraw 16 units into the air into the insulin needle. I'm going to eject the air inside the vial and then withdraw 16 units of insulin, regular insulin. Okay. I'm going to use the scoop method. Okay, I'm going to have a verify that is the right amount.
Let's see. 16. Can you roll it aside? Yes.
Okay. Okay, so I'm going to check the medication again against the MAR to make sure it is the right medication. So regular insulin matches with the MAR. Okay, Radikine, you said that your last injection site was your left abdomen? Your left
Yes.
abdomen? Okay, we'll be doing it on the right side, upper quadrant. Right side, upper quadrant, 2 inches away from your belly button. Insert 90 degree. Okay. So we're going to discard into stress container. How are you feeling, Mr. Ryder?
Good.
Okay, so please notify us. I'm going to put your call light next to you if you have any signs and symptoms such as nausea, confusion, or headache, dry mouth. And then I'm going to teach you about your medication. So you should store your medication properly. If you haven't used it, you should store it in the refrigerator. If you have opened it, you should keep it at room temperature. You should make sure that your insulin is regular, is clear, not cloudy, so it should look like water. And you should wear a Medicaid bracelet. You should also keep candy with you in case your blood sugar gets low. You can eat your candy to help raise it. Take your medication as directed. You should check your blood glucose about twice a day. You should have regular checkups with your doctor and healthcare provider. And then get your H1A, the blood glucose check. Do you have any more questions? Do you have any other questions?
No. So if I have my skin feel cold, I call the doctor.
Yes.
Okay.
So, if you have any itchiness, trouble breathing, swelling of the lips, tongue, you should notify your doctor because you are having an anaphylactic reaction.
Okay.
Okay, so,
Thank you.
and I will, here's some information so that you know what to reference back to if you have any questions. So I'm going to document the administered time, which is 5:15. So I'm documenting time, documenting the site, which is the right upper abdomen. And then I'm going, so after I type that the right upper abdomen is where the injection site was, I'm going to type that his blood glucose was 290. And then I'm going to document my initial. I'm going to click save. And then I'm going to document that we did patient teaching. Okay, let me know if you need anything, Mr. Ryder.
Okay.
Was there any important pieces of information you reviewed before giving this medication?
His blood glucose, which was 290. That's what I checked before administering the medication.
Did this information affect your decision to administer the medication?
Yeah, since his blood glucose was 290, it was above range, so we wanted to get that down to 6,000. That's why I gave the medication.
Did this information affect your administer the medication?
What was that?
Did this information affect how you administer the medication? Sorry.
No.
All right. Thanks for sharing. I learned a lot today.
Thank you.